Hi, this is Ashley. She's going to be my victim for treating external bleeding. So the first thing you want to do with external bleeding, because there's generally quite a good deal of bodily fluids, is you want to protect yourself and your victim by using some form of protective gear, such as gloves.
Nice gloves, huh?
Yeah.
Yeah, those
The next thing I want to do is be cautious that my victim should be either lying down or sitting down, because they're probably going to be getting lightheaded and possibly even going into shock. The second thing you want to do is you want to remove the clothing or cut it off, or whichever one works, and expose the wound. Then you're going to want to take gauze pad and apply a gauze pad. As long as there's nothing embedded in the wound, apply it directly to the wound with a good amount of pressure. I can use my hand if it's a large wound, or my fingers if it's a smaller wound. If I need to call 911 or attend to other injuries or other victims, I can secure the wound with an elastic bandage by going above the wound and below the wound with this roller bandage. You want the roller bandage to be snug enough that it's applying pressure, but not so tight that the victim loses blood flow to the toes or the fingers just below the wound. If there is an object embedded in the wound, such as broken glass or a broken bone, I can take a roller bandage or an ace bandage and wrap it around my fingers to create a donut-shaped bandage that would slide over the wound, and then I can wrap it in the roller bandage or in another ace bandage, and that would at least pinch the sides of that wound so that less bleeding occurs. And once I have addressed the issue, then I want to continue to treat my victim for shock while I wait for EMS to arrive. And that is how you care for external bleeding.